A 19-year-old woman is referred to the hospital for evaluation after experiencing a convulsion while jogging. She presents to the hospital with a chief complaint of high fever of 40 degrees Celsius and nausea for 3 days. The patient is otherwise healthy and takes no medication besides oral contraceptive. The patient relates that for a few days she has developed some numbness in her arms. During medical checkup, the episode of seizure began with patient suddenly stiffening and shaking for 1 to 2 minutes, after which she is confused for 10 to 45 minutes. The nurse comforts the patient in recovery position. The patient's mother reports that this episode of seizure occurs 1 to 2 times a week with loss of consciousness. Doctor diagnosed patient with tonic-clonic seizure. Doctor prescribed carbamazepine. However, after 30 minutes taken the medication, the second episode of seizures began and became worse, which may be due to drug responses in the body. For further treatment, doctor prescribed phenobarbital as the second-line drug.
A generalized tonic-clonic seizure, sometimes called a grand mal seizure, is a disturbance in the functioning of both sides of brain. This disturbance sends out electrical signal to muscle, nerve, or glands. This signal can make lost consciousness and have severe muscle contraction. Two major convulsions, usually with two phases. First, tonic phase. Second, clonic phase. Most seizures in people with epilepsy are not medical emergency. They end after a minute or two without harm and usually do not require a trip to the emergency room. But sometimes there are good reasons to call or emergency help. In over half of epilepsy cases, a cause cannot be found. If there is an identifiable cause, it usually involves the brain being affected by a condition such as: first, genetic influence. Inherited epilepsy is caused by gene mutation, causes increases excitability or brain abnormality. Second, febrile seizure in infants and children is caused by high fever or infectious disease such as meningitis, and viral encephalitis also can cause epilepsy. Third, prenatal injury. Before birth, babies are sensitive to brain damage that could be caused by several factors such as an infection in the mother, poor nutrition, or oxygen deficiency. This brain damage can result in epilepsy or cerebral palsy. Fourth, brain condition. Brain conditions that cause damage to the brain, such as brain tumors or strokes, can cause epilepsy. Stroke is a leading cause of epilepsy in adults older than age 35. Fifth, head trauma as a result of an accident or other traumatic injury can cause epilepsy. Sixth, low level of blood sugar hypoglycemia, low sodium hyponatremia, and low calcium hypocalcemia. Seventh, epilepsy is due to drug abuse such as ecstasy and alcohol misuse. The signs and symptoms of seizure vary depending on the type. Seizure can take on many different forms, and seizure affect different people in different ways. The common symptom before a seizure consists of the following: dizzy or lightheaded, headache, nausea or other stomach feelings, numbness or tingling in part of the body. Common symptom during a seizure. The tonic phase comes first. All the muscles stiffens. Air being forced past the vocal cords causes a cry or groans. The person loses consciousness and falls to the floor. After the tonic phase comes the clonic phase. The clonic stage consists of rapid muscle contractions, sometimes called convulsions. The arm and usually the legs begin to jerk rapidly and rhythmically, bending and relaxing at the elbows, hips, and knees. After a few minutes, the jerking slows and stops. Consciousness returns slowly, and the person may be drowsy, confused, agitated, or depressed. In general, the clonic stage lasts for about 2 minutes or less. After 1 to 2 minutes, you fall into a deep sleep.
The majority of epileptic seizures are controlled through drug therapy, particularly anticonvulsant drugs. The type of treatment prescribed will depend on several factors, including the frequency and severity of the seizure as well as the person's age, overall health, and medical history. An accurate diagnosis of the type of epilepsy is also critical to choosing the best treatment. Carbamazepine. Carbamazepine is an anticonvulsant and mood-stabilizing drug used primarily in the treatment of epilepsy and bipolar disorder, as well as trigeminal neuralgia. Carbamazepine is first-line drug for partial seizure and taken orally. For adults, the initial dose is 200 mg per day, whereas for maintenance dose is 400 mg per day to 800 mg per day. However, the dosage should not exceed 1200 mg per day. There are several doses for children with epilepsy. For below than 6 years old, the initial dose is 10 mg per day orally. For 6 to 12 years old, the initial dose is 100 mg per day. Maintenance dose is 400 mg per day to 800 mg per day, and maximum dose is 1000 mg per day. For kids 12 years old and above, the initial dose is 200 mg per day. The dose should not exceed more than 1000 mg per day for children under 50 years and 1200 mg per day on children more than 15 years old. Phenobarbital. Phenobarbital is in a group of drugs called barbiturates non-selective central nervous system depressants that are primarily used as sedative hypnotics. Phenobarbital slows the activity of brain and nervous system. It is second-line drug in adults due to more severe CNS sedation. This medication is given intravenously. For adult dosage is 1 to 3 mg per kg per day. For neonates below than 28 days, the dose is 3 to 5 mg per kg per day. For infants is 5 to 6 mg per kg per day. For 1 to 5 years old, the dosage is 6 to 8 mg per kg per day. For 6 to 12 years old, the dosage is 4 to 6 mg per kg per day, and for kids above 12 years old, the dosage is 1 to 3 mg per kg per day.
For drugs to work, they have to somehow produce a change in the functioning of a cell, which then leads to a change in body function or behavior. Both drugs have similar pharmacological effect, CNS. Both drugs have ready access to the brain because they can cross the blood-brain barrier easily. They have sedative effect due to cerebral metabolism is depressed. The selected drug's administration is associated with decreased cerebral blood flow and intracranial pressure. I. These drugs reduce rapid eye movement. Phenobarbital and carbamazepine give cardiovascular effect, which is vasodilation causing reduced preload, results in reduced cardiac output. Pulmonary effects. Both drugs are respiratory depressants. Depressed respiration can lead to apnea during induction. Laryngospasm may still occur because laryngeal reflexes are relatively less affected by the drug. Adverse drug reaction is a broad term referring to unwanted, uncomfortable, or dangerous effects that a drug may have. As is true of all drugs, the drug used to treat epilepsy have adverse effects. The occurrence of adverse effects depends on the dose, type of medication, and length of treatment. The adverse effects are usually more common with higher doses but tend to be less severe with time as the body adjusts to the medication. As first line of partial seizure, the treatment used is carbamazepine such as Tegretol. The treatment cannot avoiding the adverse effect such as central nervous system or CNS sedation, respiratory depression, drowsiness, vertigo, ataxia, blurred vision, and rashes. A granulocytosis as well as aplastic anemia are the other adverse effects in elderly patients. The serious case can be coma if using the carbamazepine in high dosage. Phenobarbital drug used as a second line in epilepsy treatment. The adverse effect can be CNS sedation, but may produce excitement in some patients. Skin rashes also may occur if allergic to the drug. The person goes stiff, lost consciousness, and then falls to the ground. This is followed by jerking movement. Don't panic, just take the appropriate actions. Assess. Assess the situations. Are they in danger of injuring themselves? Remove any nearby object that could cause injury. Caution. Caution their head to protect them from head injury. Time. Check the time. If the seizure lasts longer than 5 minutes, you should call an ambulance. Identity. Look for a medical bracelet or ID card. It may give you information about the person's seizure and what to do. Over. Once the seizure is over, put them on their side in the recovery positions. Talk. Calmly talk to the persons until they regain consciousness. Let them know where they are, that they are safe, and that you will stay with them while they recover.
Hi Molly, it's Miss Sharp. We're in the gym and you're okay, but you've had one of your seizures. You're going to be just fine. All right, I just need you to relax, try your best to rest. Good girl, that's right. You're doing really well. try your best to relax.